welcome. Thank you so much for joining us today. This is Ellen Kamai, the natural nurse. And as always, on behalf of myself and my co-host, Dr. Eugene Samperone, we are wishing you the best. And we'll be with you today right here on Progressive Radio Network, PRN.FM. But we'd like to tell you how you can join with us on our many adventures, both online, which is particularly important right now, but also in person. Hopefully we'll be back in the field picking plants and making medicine, and you can join us for any of these events. If you go to naturalnurse.com, you can get our newsletter just by putting your email and nothing else in the left-hand corner at naturalnurse.com. You can also find us at Facebook, The Natural Nurse, and we have many events coming up. For instance, we have a free webinar on herbs for you and your family, safe and effective use. And you can just go to naturalnurse.com calendar and find your way to sign up for that. That is an online webinar. And then we have another one that's part of the Natural Nurse Herbal Certification class. That's class 3 of a 4-class series. And when you complete that class, you get 3 CE credits if you are a person who has a license who needs credits, or you can take it just for your own information. And if you want to take the whole 4-session class, you can make up the first 2 and then get 18 CE credits. So that's available. Just go right at naturalnurse.com calendar, and you can sign up for that. We also have one coming up called Natural Nurse Herbal Certification, Feeling the Consciousness of Plants. So that's an interesting class that's going to be about natural ways to use herbs as well, but also how to communicate with plants. And what's amazing is how much is being studied right now in terms of knowing the science behind that. There's really a huge amount of science behind human-plant communication. And many of you feel like you might be communicating with another species. Maybe it's your dog knowing when he has to go out, or your cat. But truthfully, we have receptor sites, believe it or not, on our cells that allows us to actually truly communicate with plants. So many of these things are listed right there at naturalnurse.com. You can visit that and see what you'd like to take. We also have a class coming up on Hildegard de Bingen. And Hildegard is a very interesting person for any herbalist or a person interested in natural medicine to study, because she was both a nun, a spiritual healer, an herbalist, and a scientist, basically called the top scientist in Germany, even though she was a woman in her day, and she lived in the 1000s. So we're talking about a really person who was a pioneer in her day. Now today we are very happy to have as our guest Dr. Stephen Cusin. And Dr. Cusin is a physician, educator, and award-winning author, as well as also being a pioneer in something called the Shared Decision Movement, and we'll let him describe that for you. He's a graduate of Columbia College, the Albert Einstein College of Medicine, and Memorial Sloan Kettering Cancer Center. And we're going to also be talking about his new book, which I have right in front of me, The Slippery Slope of Healthcare: Why Bad Things Happen to Healthy Patients and How to Avoid Them. Dr. Cusin discusses what happens to perfectly healthy people who are the unwitting victims of medical care's 3-ring service: overselling, overdiagnosis, and overtreatment that results in unintended consequences. The slippery slope of healthcare is a cascade of escalating misfortunes produced by ever more tests with incrementally greater risks, expense and fewer benefits. And you can find out more at theslipperyslopebook.com. Thank you so much for joining us today, Dr. Cusin.
Good morning. Thank you.
Now, obviously, you have a long and involved background in mainstream and conventional medicine, certainly in terms of your training. Let's go back in time and share with us why you wanted to be a physician in the first place.
Well, that's a great question. Physicians, in many ways, have it easy in the sense of once they become physicians, I and my colleagues really don't need to question ourselves as to, are we doing good? Are we helping people? When we go home at the end of the day, can we look back and say, I was of use, I was of service, and I performed a job that not many other people can do, that we work very hard to achieve. And so in many ways, it's a ticket to self-worth, self-actualization, secure in the knowledge that you're doing good for people. That is something that most people have to struggle with. And physicians are blessed because by the daily practice of clinical medicine, that is just simply part of it. A difficult road, but one that's full of rewards. And yes, it's a wonderful living too. And that is no small part of it. But the self-worth, the idea that you're doing good is always paramount. And we're seeing it today on the front lines of the COVID pandemic, because out in front, risking their lives, doctors, nurses, all healthcare providers, remarkable job, never having to question the worth of what they're doing. And I'm stunned and so pleased by seeing it. It's a wonderful thing for the public to see too. Doctors, many of us, have and deserve a bad reputation for putting profits over people. And I think this is an opportunity for the public to see that the profit in medicine is not just, and not even particularly, given to the physicians and healthcare workers, but to the larger corporations that provide recommendations for these useless, wasteful testing, for which data is lacking or unfairly presented, that cause people to go into these technologies and find themselves in trouble. So it's an easy career to live in, although it's a hard career to achieve. It's a very competitive field. But once a physician, whether you're a DO or an MD or a family nurse practitioner, you're in great shape, and it's a wonderful thing.
Now, it's really interesting because, therefore, you went into medicine with an idea of, this could be a good way to make a living. You have, the intelligence and fortitude, and you're able to get certain grades. I mean, it takes all that to become a physician in the first place. Not everybody has that proclivity, but you did. But perhaps you had, like you said, more of an altruistic viewpoint. But during the years of practice, you're seeing that sometimes the way medicine is practiced in conventional medicine today, there's really a lot of problems in terms of, is this the best thing for the patient?
There's no doubt about it. Just the process of becoming a physician does a lot to decrease those motives that made it so desirable. There's a dehumanization process in a lot of the medical education today, so that when medical students emerge from medical school, the nature of the curriculum, the lack of humanism in the curriculum, the lack of liberal arts in the curriculum, make us, I think, pseudoscientists. We're not really scientists. We're clinicians. And we lose sometimes the human aspect of illness, and in so doing, decrease what we can offer to people that is so otherwise valuable. So the spirit that guides so many of us become depleted through medical school and through the daily burden of practice in the current system, the fee-for-service system as it's envisioned, where the volume counts more than the quality. And the nature on which physicians are reimbursed have very little to do with the benefits that come from what they do, the complexity of what is being offered. It's a system in need of reform. It's a system that is failing the public. It's a system by which Americans are paying at least 2 times more than other advanced economies, and yet lags on every indicator of quality, access, equanimity in services, and outcomes. Public health, which is an unsung hero, and we're seeing it in play now more than we've ever seen it before. The role of public health is so paramount. Its benefits are so incredible, and yet its contribution to medical care in general is so minimal, and it's such an underfunded part of the American medical system. I think that this pandemic will do a lot to focus Americans' attention on what's valuable about American medicine, the people they're seeing on television, rather than historically, which is a kind of a fee-for-service free-for-all, where healthy people don't need health care, but are encouraged to get it, which is the theme of the book. This is not a time where overdiagnosis and overtherapy is much of a message, because we're in a period now with the pandemic that's underdiagnosis and undertherapy, which is kind of unusual. And that shows the failing of the reserve in the medical system to deal with problems that affect millions of people in this country, while the system that preceded it before the virus was addressing its attention to the insured, the wealthy, the nervous, the anxiety-ridden people who are susceptible to a message.
To a message, like you say. And we are talking here today with Dr. Cusin, Dr. Stephen Cusin, and we're talking about his book, which is totally an eye-opener, The Slippery Slope of Healthcare. And I know that a lot of this is really politically generated because, for instance, in 1924, the AMA, under the leadership of Morris Fishbein, was actually purposely put in place to really make medicine based on 2 things in terms of the education of doctors: pharmaceutical drugs and surgery. And they actually purposefully and very politically removed a lot of the courses about natural therapies that were extremely safe and effective, and such things as nutrition and baths and talking to our patients. All of that was removed to where everything boils down to what you're saying, Dr. Cusin, which is a very expensive test or an expensive drug that really does not look at that client in most cases in a holistic way about what kind of side effects might even the test engender.
There's no doubt about that. I agree. The technology now has overcome humanity. The whole idea of the way medical care should be delivered has been violated by political, economic factors. It's very hard to, in our system, which is a $3.5 trillion with a T, $1 trillion system, to tell people who are getting untold wealth that now that which their incomes are dependent upon has to be rethought. They'll do everything. They'll lobby. They'll relieve the information in spurts, poor information, bad information, unvetted information, emotional drives. And our country, not to be too conspiratorial about it, but lobbyists and money still, to a substantial degree, rule medicine. And there'll be a point in time when the public will understand that and know that the healthy don't really need that much health care. Health care is not for the healthy. Nutrition.
Well, it could be turned around so that health care is about health. I mean, as a nurse, which I've been since 1973, and I've been doing holistic medicine since 1964, so a long time in the field, and I've certainly seen many changes. If I walk into a doctor's visit now, and the poor doctor has 8 minutes to see you, and most of the time he doesn't look, touch, smell, or in any way interact with the patient, the doctor is at the computer trying to search for the right billing code and then scribble something on a piece of paper, some drug that might interact with all the other drugs the client is taking, which they don't know because different specialists give different drugs and nobody seems to have a concept about the whole soup there, what's going on, and then walks out because he's got to see or she has to see the next client. That just seems very far off base.
That sounds so terrible. It sounds so negative, and it's so sad that you're right. That is a medical interaction, by and large, in the United States today. You're lucky if your physician gets a chance even to look in your eye, much less ask what you want, what your priorities are, what your risk tolerance is, what you'd like to do rather than what they tell you to do. And the whole stimulus behind medical care is, again, fee for service. It may be.
So what about this, Doctor? I was recently with a patient she was in the hospital. She's 90 years old and she weighed 70 pounds. And in the room across the street, there was a man who was 50 years old, 250 pounds. They had both had a similar incident in that they both had a stroke. The gentleman had a rather more of a major stroke. The 90-year-old female had a tiny stroke. I actually looked at the MRI screen. It was like a pin, like a pencil point, and she had almost no symptoms, just a little bit of balance that was off. And yet both of those patients were on the same exact 5-drug regimen at the same dose.
There's no balance. There's no proportionality. There's no sense of why is this patient different from the other patient. The same medication in two patients who have identical diseases, identical backgrounds, in this case, in identical weights and backgrounds, causes completely different reactions in each. There's no one medication that works for everyone. And not every medication works for everyone. In fact, most don't. But the sense of getting an environment, a surrounding in which a patient can feel comfortable based on their characteristics, their demographics, their values, this is an issue that you're absolutely correct, where the idea of herbs, botanicals, vitamins, and mineral supplements in traditional current American medical system is obviously minimized, even ridiculed, and certainly not taken into account when people who like these supplements can express themselves and be accepted for the value of their opinions. It's a system that is out of whack, it's out of balance, that there's no silver lining to what this country is going through now, what the world is going through now. But perhaps on the other side of it will be a point in time when we can look to what was going on while we were not getting any elective care. There's no elective care. And because there's no elective care, the hospitals are struggling because elective care for things that in many cases are completely unnecessary, are going to rebound with great vigor because hospitals rely on this for 60% of their income. And yet most people who are at home, there's some people who are suffering terribly because they're chronic conditions that need care. The unhealthy people who need monitoring and surveillance and follow-up is being ignored on a relative scale because of the emergency. But so many people who are perfectly healthy putting off things that they never needed in the first place, battles that never needed to be fought, health that was never lost that somehow they feel needs to be regained. I think that maybe after this, people will say, I did okay without that surgery that I was contemplating and even scheduled for that I had to cancel. Maybe it's time for me to rethink the need for that. Maybe it's time to start thinking what we need as a population rather than as individuals, because that's what public health is. Throughout the years, if you asked people, what do you think the proportion of increased life expectancy that we've had since the 1920s is due to modern medicine versus public health? And the vast majority of people will say modern medicine, modern care, delivered by physicians today accounts for the vast majority of our increased life expectancy. It's not. It's the public health initiatives that deal with the population, that deal with behavioral change, clean water, sanitation, discontinuing harmful habits, the use of nutrition, the use of goals that the public should aspire to. Good Health 2020 is an initiative that's coming to an end this year with many goals, all in the public health sphere. These are the goals that increase people's lifespan. These are the goals that make people live happier, healthier, more vital lives. The kind of benefits that come. Look, when it comes to screening, I'm not opposed to any screening technology that's been accepted by the United States Preventive Service Task Force. But what I do object to is people signing up for it without knowing what they're doing, not knowing how minimal the benefits are, how severe the harms can be.
Wait, let's
and
talk
not
about
being given
specifics.
a
Like, what kind of tests are you referring to, Dr. Cusin, which I know you talk about in your book because I have the book here? Very specific tests that actually the possible harm might outweigh any possible benefits of having a specific test done.
For example, for men, and you're absolutely right about that, for men, the prostate-specific antigen, the PSA test, several years ago, the United States Preventive Service Task Force said, don't do it. Throughout all of the United Kingdom, they don't let people do it, don't want people to do it, and they encourage them not to do it because the harms are so terrible and the benefits so questionable. 2 years ago, they changed their mind here in the United States, but the qualification they gave for doing it is the benefits are few, the harms are many, and to get those benefits, you better speak to your physician and learn about it before you sign up for it, because it's highly optional. And yet, I go to my doctors, and they always check off that PSA test. And I say, I don't want it. And they are amazed. When you read about PSAs, and you read about mammograms, you read about lung cancer screening for smokers, the benefits are heralded, they're emphasized, sometimes exaggerated, while the downsides, which are the harms, which can ruin lives, take lives, offer no benefit for the vast majority of people doing it, are minimized to the point that you never hear about them. And that, to me, is a really great shame, because screening may be for some people who are willing to take the risk, but screening inherently is going through a test today and taking a risk for it, and the risks do exist, the harms do exist, for a disease that you probably won't get 30 years in the future, many of which don't need to be diagnosed now, can be treated then, or don't benefit from treatment even when they're diagnosed. And so it's very hard to talk about mammograms in the sense of questioning them, because it has become a bit of a political issue, given the way women appropriately feel that their needs are not being correctly seen to, and it runs over into mammograms where women are of the feeling they must get these tests. A woman who knows the benefits of mammography knows the potential downside. For example, if you ask a bunch of doctors and you ask a bunch of women, if you have a positive mammogram, what are the chances you actually have breast cancer? Doctors don't know. Women certainly don't know, and they're the ones who should know. That those two groups are the ones who should know the most. A woman with a positive mammogram only has a 10% chance of actually having breast cancer, but she has 100% of a chance of getting more and more tests in order to show that. And that means biopsies and radiation exposure, misadventures, diagnoses that don't really mean much, diagnoses that are made based on the best knowledge, with a firm understanding that many women don't benefit and others are hurt. True of prostate-specific antigen, true of thyroid cancers, true of lung cancers. It's not that people shouldn't do it. And the book goes into resources that people can use to get a true idea of the benefits and the harms. And that's shared decision-making. The government demands shared decision-making for lung cancer, breast cancer, prostate cancer, and it's simply not done. maybe 5 to 10% of people get a shared decision-making session. The last chapter of the book goes into the resources of shared decision-making. How does a patient learn about those things that are in their interest, those things that might harm them, and are used with precision? You watch a commercial on TV for some medications that are actually really quite good for serious diseases, and they say many people get significant improvement. What does that mean? You can't make a decision based on these fuzzy adjectives. There are tools out there that allow patients to know exactly how many people will benefit.
What tool would you suggest, Doctor?
Well, in the shared decision making, there's very little in the United States. If your listeners go to the Ottawa Decision Center, they'll find decision aids that take people through a huge variety of tests and diagnoses and recommendations regarding medications that say, here are the benefits, here are the harms. Let's take a look at your values and allow patients to state what kind of risk they're willing to take in the pursuit of problems that they don't have and probably will never get. That doesn't mean they're not worthwhile. Mammograms save lives. Prostate cancer prevention saves lives. Lung cancer screening saves lives. But the benefit is so razor thin, and the downside is so horrific in many cases, it serves the purpose of people out there to know what they're getting into and then making a decision based on where they are in life. A 40-year-old man or woman who's working and has 2 or 3 kids, if they take a risk today for something they may get when they're grandparents, really has to be thought out. Because while an 85-year-old man who dies from prostate cancer is irrefutably sad, but if a 45 or 50-year-old man dies in trying to prevent it, that to me is tragic. And what tragedy is the fact that that person had no idea what they were getting into. Buyer's remorse, regret, looking back at the decision, those are amongst the most terrible things that a patient can have. Gee, you should have known about this. Gee, what a shame that didn't have to be this way. Whereas if you know what you're getting into, you're willing to take the risk based on your personal desire to do risk, then a bad result can be seen, if not enthusiastically, at least philosophically. I mean, some people are into alpine skiing off the trails. Other people will want to be on a trail. Other people will want to do cross-country skiing. Other people will just be happy sitting at home and watching people ski on television. These are all people who can take different risks and are willing to do so.
Well, we're going to take a little break right here so we can bring you the natural medicine chest, and hopefully our engineer's listening in, because I was trying to email him and that's not working. But at least we're both on the phone here with you. We're speaking today with Dr. Stephen Cusin. He is the author of The Slippery Slope of Healthcare, Why Bad Things Happen to Healthy Patients and How to Avoid Them. And he's talking about some, regular tests that people go for. We'll talk when we get back about what about pre-diabetes, pre-hypertension, and pre-Alzheimer's? Do we need to do tests for that as well? And are the tests worth it? And do we get in more trouble through the treatments via those tests? And is it based on increasing income or increasing health? That's the question. We will be right back with more right here on The Natural Nurse and Dr. Z.
On this edition of the Natural Medicine Chest, we'll discuss the nutrient known as taurine.
Amino acids are chemical constituents that form the building blocks of protein in the body. The official definition of an amino acid is a compound which contains an amino group and a carboxylic acid. Taurine contains a sulfonic group instead, so is not a true amino acid, although it is often referred to as one. The intracellular concentration of taurine is 10 times that of any normal free amino acid.
Taurine was discovered in 1827 But the significance of taurine in nutrition was not realized until 1975, when the journal Science published a study showing that taurine-deficient cats suffered from retinal degeneration. In 1986, the Annual Review of Biochemistry reported that the amount of taurine present in mammalian milk depends on the species. Natural human mother's milk is rich in taurine, but cow's milk, except for the early milk known as colostrum, is taurine deficient. Pediatrics Journal in 1983 printed a study which outlined several of the biologically significant functions of taurine, and an effort was then made to fortify infant formula by adding taurine.
Some species of animals, such as cats, cannot synthesize taurine within their bodies, and so must receive it through their diets. Humans have a very limited ability to synthesize taurine, so adequate intake through diet and supplementation is important. The principal source of dietary taurine is meat of various types and shellfish. Even people ingesting sufficiently high levels of taurine may develop a deficiency due to the overgrowth of certain anaerobic intestinal microorganisms which consume taurine. Certain prescription drugs are known inhibitors of taurine uptake.
The Journal of Neurochemistry published a study in 1975 which showed that taurine concentrations are extremely high in the retina. In fact, the retina contains two binding proteins specific for taurine. Research has yet to determine exactly how taurine functions in the eye, but deficiency of taurine has been found to lead to the degeneration of photoreceptor cells. Continued studies on taurine have linked its presence to several biological functions, besides being a protector of the delicate tissues of the eye. Taurine helps to neutralize oxidizing agents caused by ionizing radiation. Taurine is present in high concentrations in the normal heart. It stimulates white blood cell motility and protects cell membranes from free radical damage. Taurine has proven useful in epileptics to reduce or control seizures. It helps modulate the transport of substances such as sodium, potassium, magnesium, copper, and iron across cell membranes. Additional research supports taurine's role in preventing gallstones.
So, as you can see, the nutrient taurine may be an important addition to your natural medicine chest.
On The Natural Nurse and Dr. Z, please get in touch with us. Visit us at naturalnurse.com. Sign up for our newsletter by going to the bottom left-hand corner and just put in your email. Go to calendar to see all the classes and workshops we have coming up. And of course, we also teach privately, so you can just send an email at naturalnurse.com or a message at Facebook, The Natural Nurse. Today, we have as our guest Dr. Stephen Cusin, and he is the author of a new book called The Slippery Slope of Healthcare, Why Bad Things Happen to Healthy Patients and How to Avoid Them. So, Doctor, why are healthy people affected first and benefit the least and harm the most by some of the procedures and tests that are normally done in what they call preventive health care?
When people are sick and they need to be diagnosed, they need to be studied, they need to be treated, it's always accepted there's some degree of risk that comes with a workup and that comes with therapy. But when you're healthy, all you're getting in many cases is the risk without the benefit. And that's why healthy people are hurt the first, because they weren't anticipating being damaged. And they're hurt the most because they go from healthy to unhealthy rather than unhealthy and having to bear the responsibility and the understanding that because they're unhealthy, certain things need to be done to help these nice folks. But when you're healthy, it's not that you should avoid health care. You should be skeptical of it when you're feeling just fine. And you mentioned before the break, pre-hypertension.
Pre-hypertension, that's a good one. People probably are familiar with, yeah.
Yeah, this is the subject of my first chapter, the hypertension hoax. Half of the United States woke up on November 17th, 2 years ago, to find out that they become hypertensive overnight. It's a diagnosis, blood pressure, and diabetes in many cases. It's defined only by numbers. And so all you have to do is change a number, move the goalpost, and all of a sudden more people have that diagnosis because it doesn't have symptoms associated with it. It's only defined by a number. And when those numbers are very low or just peeking into the abnormal, most people do just fine without any attention. When I went to medical school, and that was the same time you went to nursing school, hypertension for me back in the 1970s into the early 1980s was a blood pressure of 140 over 90. Above that, they would be treated. Now, it used to be 130, and 120 over 80 was considered to be normal. Now, overnight, based on the American Heart Association, 120 over 80, the blood pressure everyone thinks of as normal, is now defined officially as elevated blood pressure. And if it's higher than that, it'll demand therapy. And once you're treated for hypertension, real or fantasized, you go to your doctor and they say, you're hypertensive. That's a risk factor for heart disease. And heart disease is the number one killer in this country. Let's do a cholesterol. And if your cholesterol is just peaking into the abnormal area, you're going to be hit with a statin, a cholesterol-lowering medication. So now your physician is saying, you're hypertensive and you have high cholesterol. We better do a stress test. Even though that patient has no particular risk for coronary artery disease, no family history of coronary artery disease, and no background that suggests there's a particular risk for it, and now someone in their 40s or early 50s is subjected to a stress test or a coronary artery calcium, these huge screening technologies that are good for people who need it, but bad for people who don't. So you go from someone who's wandering around in their lives with a blood pressure of 130 over 80 or 130 over 90, and all of a sudden they're hypertensive. Then they get another diagnosis and another diagnosis, another diagnosis, and these become more risky, more expensive, all to a purpose of making a diagnosis that never needed to be made in the first place. And I find, like pre-Alzheimer's, as you mentioned, that to me is the most pernicious, dangerous, anxiety-producing myth that the medical establishment is proposing today. It's a horrible disease. My mother had it. My mother-in-law has it. I worry about getting it. But the understanding is it's the public health initiatives that are going to do the most to prevent it. Lifestyle changes, the use of supplements, vitamins, minerals, the use of maintaining a weight and an exercise regimen. But there's no benefit to knowing that you might be or might not be more or less susceptible to it, because aside from the things that I just mentioned, there's absolutely no therapy for it. I wouldn't take a test today to see if my profile is such that might lead to a higher than likely occurrence of Alzheimer's, because I'm doing the best I can. And if people out there are not doing the best they can, these lifestyle issues are so much more important in preventing cancer than screening, that these are the things that are difficult to do but should be availed. But the idea of making a diagnosis of pre-Alzheimer's doesn't help people. It only scares them. Changing definition of diabetes, the hemoglobin A1C. Anyone of your listeners out there who's diabetic knows about what the hemoglobin A1C is. What they may not realize is that there are 4 or 5 societies that comment on what's a normal hemoglobin A1C.
Well, what would that be? Well, let's talk about why that might be important for people to know their A1C, Doctor.
A1C is important because if it's truly elevated, then attention toward lifestyle, diet, exercise, the use of those kind of supplements that clearly will benefit a diabetic, and not unlike the taurine that you just mentioned, these things are reasonable to do. But if you're pre-diabetic or have a hemoglobin A1C that many societies don't recognize as being diabetic, then if we can't decide as a medical group what is the definition of diabetes, how can patients have any confidence in it? And pre-diabetes is something that you don't have it yet. and it's not even a clear clinical entity. There are some papers that say if we follow pre-diabetics for a matter of several years, a certain percentage will become diabetic. That's okay, but you shouldn't treat pre-diabetics aside from the lifestyle, public health, alteration in diet and exercise and supplement use. That's okay. But a diagnosis carries with it anxiety. And preying upon the anxieties of people is how you get them into healthcare testing, diagnostics, therapeutics, elective procedures that in and of themselves, in my view, many are unnecessary. And even if they have a value or a worth, individual patients don't really know what they're getting into. All they know is that they've been scared. Even with the pre-hypertension thing, when they changed the diagnosis of hypertension on the website of the American Heart Association, it says, don't panic, but call your doctor right away. Those two statements are completely at odds with each other. And so to instill a fear of a condition that is not treatable and one that is amenable to lifestyle modifications, that isn't what makes money for the groups that want to make money. And screening and treating diseases, changing the definition of diseases, these are the kind of things that make money. These are the kind of things, terribly, terribly sick people who are in the intensive care units, who need and deserve the most advanced technologies according to their wishes, things that are reversible. These things don't make hospitals a lot of money. In fact, many hospitals lose money through their intensive care units. Hospitals make money in the operating room. Hospitals make money in screening technologies. Prostate cancer days where the doors to the hospital are wide open. Get your free PSA today. Yeah, the PSA is free, but when a substantial number of men land up with an elevated PSA, that's when the cash register opens. So sure, make it free, but it's silly in that people walk in and say it's free. I've heard about it. I've read about it. Let me stick my arm out and get this blood test. And it's the same thing with mammograms, same thing with screening for things that should not be screened for, like brain cancer. Brain cancer is terrible, but screening for it, if you have no risk or particular risk factors or symptoms, is going to show all these false positives. And that's when the three-ring circus opens. And you've bought a non-refundable ticket to the overdiagnosis, overtherapy, and overdoses that are so common, turning healthy people into patients. And one of the themes I like to use in the book, as horrible as it sounds, is unscheduled dying. People who are healthy die to achieve health when they have absolutely no reason and to have no knowledge about what they're facing in the face of the recommendations that are being made to them. Look, doctors are not, I'd say most doctors, are not in the business of saying, do this, and saying to themselves, we know it's a waste of time. There's a bias that doctors have that this is what I want to do. This is what I trained to do. This is what I worked hard to do. This is what I'm paid to do, thanked when it's done. And I'm told that these things are important. Doctors are not scientists. And doctors often don't keep up with what the most current information is offered out there. Science plays a very tiny role in medical care. Now, even now...
That sounds like a shocking statement. Science plays a very tiny role in medical care. I actually agree, because when we look at something, let's say, called leaky gut syndrome, and there's a vast array of evidence-based medical literature looking at intestinal permeability and its direct link to inflammation, and then, of course, the link of inflammation to pretty much every disease process, and yet gastroenterologists do not even, they say they don't believe in it as if it's a spiritual belief system. Yet the literature is rife with very specific information. So you really wonder, are the doctors reading the literature?
No, they're not. And I am a gastroenterologist, and I practiced gastroenterology for almost 30 years. And there is a virtue to the role of bacteria and viruses, healthy bacteria in the gut, and the gut's role in immunology, inflammation, disease states. And yet, in most practices, on that 8-minute visit that you mentioned earlier, if a patient voices a concern about the bacterial population of their gut, the doctor will nod sagely, and he or she will go to the prescription pad and write a quick prescription for a probiotic. They won't discuss probiotics, prebiotics, intestinal permeability, inflammation, modulators of inflammation that are on the market in the dietary supplement, antioxidants, and things of that nature. Patients want to hear it. Patients deserve to hear it. There should be access to these resources, but it's not going to come in that 8-minute visit. What they've done is just a simple prescription saying, go buy this probiotic. You're absolutely right. You go take this thing a few times a day. Buy some yogurt and don't bother me anymore with it. The science on a leaky gut is out there, and it's very exciting part of the science today because it offers the potential for so much benefit through the use of agents that modify or correct the use of bacterial infiltration of the intestine that's not in the benefit of patients who have these bacteria that have been colonized by the use of the rampant use of antibiotics and the rampant use of foods that don't work to restore normal balance within the gut. It's understood, it's out there, but there's no test for it. There's no diagnostic tool. There's no profit to be made from it. And where doctors may bow their heads and say, yes, eat yogurt and take a probiotic, there's no understanding of the science or discussion that patients are going to achieve without going to their own resources, such as you, such as the resources I use in my book, to allow patients to have search engines that allow them to see doctor-only literature. There's nothing wrong with the literature out there as it exists, but not all of it is as good and as rigorous as it might be. Doctor-only research, which is shared by many people who aren't physicians but in the healthcare field, these are resources that you could bring to your healthcare providers and say, I read in this article about taurine in diet, and do I need a supplement because of how rich it is in the eye and the brain and the muscles?
So hold on 1 minute with that thought. Hold on 1 minute with that thought. And I want to remind you that you are listening to Dr. Stephen Cusin, and he is the author of The Slippery Slope of Healthcare. You'd be really interested in seeing all the information in here about why bad things happen to healthy people and how to avoid them. We're going to take a little break here so you can hear more about Progressive Radio Network, which is our mothership here. That's where we are coming to you from, and all the wonderful other shows that they have available to you. We'll be right back with more right here on The Natural Nurse and Dr. Z.
Stay up to date with PRN for the latest on the coronavirus. Learn ways to stay spiritually vibrant and physically strong on PRN.FM, the Progressive Radio Network.
Yeah, I'm not known as a gadget guy, but I love gadgets that really do the trick, like the new app. The Progressive Radio Network has an app thanks to our friends at Audio Now. Hey, this is Mark Farrell, host of Insight on Thursdays at 11 a.m. Eastern Standard Time, where we broadcast live out of New York City. But if you can't catch the show live, no frets. It's always archived. It's always on the app. Download it now, listen later, whenever you want. The Progressive Radio Network app is available from our friends at Audio Now. Check it out.
You are listening to PRN, Progressive Radio Network.
And thank you once again for joining us. We're so happy to have as our guest today Dr. Stephen Cusin. That's K-U-S-S-I-N. Dr. Cusin, believe it or not, we're almost at the end, so we're going to give some contact information before we run out of time. So what are some of the best places to people for people to find out about your book and to get in touch with you?
Any online store that sells books will have my book on it, and the information regarding what you can find in a book and the reviews to date of the book will hopefully be a stimulus for people to avail themselves of the information that I'm so unspeakably proud to have to offer to people, because it's easy to offer things that have a superficial benefit to them, but it's far more important for people to understand that which is put before them as being some scientific, some speculative, some the work of charlatans. And I think that looking at the book, looking at the cover, reading the information that Amazon or Books A Million or Barnes & Noble has, will give them a good running idea of what I'm trying to accomplish with this book.
Now, how about a website address? Would the one that I mentioned be useful, like theslipperyslope.book.com?
Yeah, the Slippery Slope book. Yes, that should be up, and it's up now, but it'll be fully running next week. This book has come out at a time where I canceled my book tour, I canceled all my book talks, and all the people who are going to help me with the artwork and web design are otherwise engaged. So the website will be up next week, and I'm proud of it. I hired a wonderful artist to do slides and explanations of chapter-by-chapter lessons that the book affords its readership. So, yeah, I would encourage people to get online to Amazon or Barnes & Noble and just type in my name or The Slippery Slope, and they can read about other people's views of my book, critics, readership, and the message of the book that the cover and back cover material cover rather well, I think.
It's excellent. And you talk about really the tension between something like the dollars in the healthcare industry and the fact that what they often do is meaningfully block healthcare reform rather than support it. That would make our country, it's really a shocking figure that you discussed at the beginning of our discussion today, that we spend more per capita on healthcare than any other country in the world. So you would think if that related to us being number one in health, that would make sense. But on a country-to-country basis, we're something like 37th in the world in health, and yet we spend the most.
It's always a mystery to me why, when people are given this information, if our Olympic team performs so poorly in ice hockey against all other countries, they'd be rioting in the streets. Here in the United States, infant mortality, maternal mortality, life expectancy are all amongst the lowest in the industrialized world, while individuals are going broke, and they still do, paying twice as much for that care as those other countries. And that's why hopefully a book like mine and other books out there from really terrific people might heighten awareness of an individual's choice, individual's knowledge as regards decisions that are made in the healthcare sphere, where $3.5 trillion is at play every single year. $3.5 trillion, in the COVID pandemic, the government just released $2.2 trillion, and it's considered to be an amount that's so unbelievably stratospherically high, it defies any understanding of what it actually means. And yet every single year, our system spends a third more than that in the routine care of patients, that at least a third of which, probably a half, is wasted. Wasted in profit, wasted in injury, wasted in recommendations that are not backed up by science or even by good anecdotal observational evidence. And so it's a sad thing when we fare so badly. And look, how's the United States doing right now in fighting the COVID pandemic compared to other countries? Put the politics aside. It's just raw numbers. How many people have had it? How many people are dying from it? What is being done to stem it? And you compare us to Europe, to Eastern Asia, and to not know that we're coming up horribly short. You could blame who you want. You could blame the administration. You could blame the healthcare administration system. You can blame public health. but it's a fact that demands some explanation and some reckoning when this day is over and we're beyond this terrible time, to say, what did we do wrong? Why did so many Americans die? And what can we do to prevent this in the future?
Well, I want to thank you once again so much for being our guest today, and your book is chock full of really interesting information on many levels, scientific, political, and in terms of compassion. So thank you so much for being our guest today, Dr. Kusin. And thank you, listeners, so much for joining us once again for another edition of The Natural Nurse and Dr. Z. Get in touch at naturalnurse.com or Facebook The Natural Nurse. On behalf of myself, Ellen Kamhi, The Natural Nurse, and my co-host, Dr. Eugene Zamperone, we wish you the best and hope that you stay healthy.